Huntington's Disease by Joshua, Lexi, and Ellie. Huntington's disease is an incredibly rare neurological disorder. There are only about 200,000 cases in the US per year, and only 1 out of 13,000 people contract Huntington's disease from genetic material. That's about 1 person out of the entire population of Kennesaw, Georgia. Huntington's disease is genetic, so it is passed down through families. It does not discriminate based on race or gender. Instead, it discriminates on age. The older a person is, the more likely their Huntington's disease is to progress or develop. American songwriter and folk singer Woody Guthrie died in 1967 of Huntington's disease. His death led to the creation of the Huntington's Disease Society of America, which has helped fund and support research for the cure for Huntington's disease. Famous Brooks and Dunn drummer Trey Gray also has Huntington's disease. He is an active member of the Huntington's Disease Society of America, and he says that drums help him cope with his illness. Huntington's disease has many negative effects on the cognitive, muscular, and behavioral systems of a person's body. They might have amnesia, a lack of concentration, mental confusion, or a lot of slowness in activity or thought. They might have a hard time walking, involuntary movements and problem with coordination, and even muscle loss. Some behavioral and psychological issues might be depression, delirium, hallucination, or paranoia. Huntington's disease is passed on in an autosomal dominant pattern, so only 1 copy of the gene in each cell is enough to cause the disorder. An affected person usually has at least 1 parent with the gene. Almost all times they only have 1. In some cases they can have no parents. This Punnett square represents the situation that the majority of Huntington's patients are in. They have 1 parent that has Huntington's disease, which is heterozygous, and 1 parent that doesn't. So from this cross you can see that 50% of the kids have the disease from those 2 parents, which means that only half of the children end up with Huntington's disease. Huntington's is an incredibly complex genetic illness, neurological illness, so it requires a pretty complicated plan from multiple physicians. You might need to see a neurologist, a psychiatrist, or a geneticist to put together a treatment plan for you. Although there is not a cure for Huntington's disease, there are many things you can do to manage the symptoms or to deal with grief or shock. There are oral medicines, physical or talk therapy, or even family or individual counseling. The majority of the psychological damage that happens during Huntington's disease is when a patient finds out that they have the illness and have to deal with that almost impending terrible death that they might have to experience. Huntington's disease requires genetic lab testing to confirm a diagnosis from a physician. Anyone with a relative that's diagnosed with Huntington's disease is highly encouraged to visit a genetic testing lab and get tested. There is not really a major ethical dilemma associated with Huntington's disease. It is widely accepted as an uncurable disease, and there is no prenatal treatment or fetal treatment. The only preventative way to keep it from passing on is to not have kids, which that could be an ethical situation because one day we could have maybe restrictions on those people that want to have children with Huntington's disease.